Have you ever experienced given some information or being confronted with some news that you weren't expecting? Some news that was difficult to receive. And in that moment, you found yourself with emotions of devastation, maybe even feeling embarrassed or denial. But then when you had a moment to think about it, to let it sink in and gnaw on it a little bit, you decided instead to rally, to become empowered, to embrace that information that was so difficult to receive and grow from it. I had that experience. I had that confrontation years ago, early on in my dental hygiene career. And it still feels like it was yesterday because it was so impactful. I was at a wedding reception in my town of Idaho Falls, and I saw that there was also a past patient of mine there, Yvonne. Now, Yvonne and I had worked together for several years, and I hadn't seen her for a while because her son had graduated from dental school, and she and the family now for a couple of years had decided that they would have, of course, their son treat their dentistry needs. So like me and many of us in the audience, I really felt what set me apart as the best hygienist and our practice as the choice for our patients to come to, it's because we treated our patients as if they were family. That's how I felt about Yvonne. So when our eyes met, I put a big warm smile on my face. I started to go like this, and the reunion was not the same. Yvonne was cold and indifferent. And in that moment, I felt confused. But I left after a little chit-chat, went and sat down, hoping that everything was okay with Yvonne. I was hoping that this wasn't something that she was struggling with within herself or her family. A little bit later in the reception, I went off to the restroom. Yvonne followed me. She confronted me. She said, "Jamie, my first hygiene visit with my son's new hygienist, she told me I had an infection in my mouth. I had a disease around my gums that needed to be treated differently. She even asked me if I'd ever been told that I have periodontal disease. You never told me I had an infection in my mouth. I trusted you." I felt devastated in that moment. I was embarrassed. I felt defeated. I was also in denial. My next fleeting thought was that overzealous hygienist. So I stewed on it all weekend long. I gnawed on it. And when I got back to my office on Monday morning, guess what I did? Opened up her charts, looked at her records, read my notes, looked at every single thing from start to finish. But this time, I did it with a different set of eyes. I looked at Yvonne's records as if it was the first time I'd ever seen her, that I was seeing her for the first time. I was wrong. That overzealous hygienist was right. Sure, I talked to her about how to floss with the perfect C shape around and go subgingivally, and I had taught her the best BASS technique possible, right? But where I failed her is I didn't call the disease what it was, and if I'm treating her as if she's family, I never gave her the opportunity to own her own disease. And I also failed her because I never gave her the appropriate care for the disease that she had. Now, the gift in that crucial conversation, that difficult moment in that bathroom, gave me the opportunity. It gave me the opportunity to take that information and use it to empower me, to change the way I moved forward with how I treated my patients. It gave me the opportunity to change my mindset. Now, it also could have defined me as the worst possible hygienist on the face of this earth, or at least the one that walked the streets of Idaho Falls, Idaho, right? Or I could allow it to have me step up to the plate and be the very best healthcare provider and hygienist that I knew I was. I chose the latter. And so my mantra moving forward that day was that I would treat every single patient that ever sat in my chair as if they could leave and walk out tomorrow, 6 months, 6 years from now. And they were going to be seen by another expert in the field, another dentist, another hygienist. And what would they tell my patient, my family member, about the care they had received before they sat in their chair?